Yes. Good morning, good afternoon, and good evening, everyone. Thank you for participating in today's global seminar. I would like to start by acknowledging and celebrating the first Australians on whose traditional lands we meet and pay our respect to the elders past, present, and emerging. My name is Nurkemala Muliani, and I will be chairing today's session. And I'm hosting this seminar together with Dr. Arianto Patundru and Baskara Adiwena. The seminar is made possible with the support of the Australian National University and the Department of Foreign Affairs and Trade. Today's seminar, PSBB and COVID-19 in urban areas of Indonesia, will look at the recent situations in two of the biggest cities, Jakarta and Yogyakarta. And we are very honored to have distinguished speakers joining us today. Some of you from Canberra are probably already familiar with Dr. Suharti. She did her PhD in demography at ANU and graduated in 2013. She has a stellar career in Indonesia's public service. She was the Director for Population, Women Empowerment, and Child Protection at Bappenas. And then she was the head at the Bureau for Planning and International Cooperation at Indonesia's Ministry of Education and Culture. And she is currently the Deputy Governor for Population and Settlement Control at DKI Jakarta Government. Also joining us today is Dr. Ngabila Salama from DKI Jakarta Department of Health. We also don't need a lot of introduction for Professor Budy Resosudarmo. Professor Resosudarmo is a developmental and environmental economist. Budy is a professor at the Untitled Department of Economics, and he is also the deputy head at the Poverty and Inequality Research Center, and he was the former head of ANU Indonesia project. Professor Resosudarmo has been working on understanding the impact of disasters and environmental quality, human health and welfare development for more than 20 years. During this pandemic, he conducted a phone survey in Jakarta and Jogja to monitor the social health impact on COVID-19 pandemic in those cities, and he will present the preliminary findings in this seminar. Without further ado, I will give the floor to Ibu Suharti. Silakan, Ibu.
Thank you, Mbak Anduka. Share my presentation here. Good morning, everyone. Good afternoon for you in Australia, and good evening, perhaps someone else there here outside Jakarta or Indonesia. I'd like to present on the COVID-19 in Jakarta. We'll be briefly inform you about the current status of the virus in Jakarta. Then we'll briefly share about what happened in early September when the Jakarta government pulled the emergency break the times, and some response to COVID-19 in Jakarta. Here is the updates up to yesterday, 113,000 cases in Jakarta with the positivity rates about 8.3%. The good thing is that the recovery rate is quite high, 91.6%. So we now have active cases of 7,500 cases. Let me move this one. The case fatality rate is also quite low, 2.1%. Lower compared to the national average at 3.3%. So now we have the number of deaths at 2,390. That is the confirmed deaths, not including the suspects and the probable cases deaths. And we tried our best to improve the testing capacity. In the last week, we could test more than 60,000 new cases. So it's more than 6 times of the minimum standard of the WHO. And in total, we already test to about 128,000 of populations per million population. So that's the what happens right now. And here is the trends of the active cases, and you can see here that the active cases have been decreasing since mid of October after 1 month of flattening from mid of September to mid of October, and probably it's because of the emergency break that we pull in mid of September. And The reproduction rate is still above 1.04 per egg. It's increased from about 1.03 last week. So yes, there is a bit increase in the numbers of daily cases. As you can see in the right graphs, the tails increasing a bit. It's also linked with the mobility rate of the Jabodetabek people. And this one, you can see here, the changes in the mobility of people in Jabodetabek decrease around the long weekend end of September. And number of deaths also decreasing since September. And the good thing is that the gap between the number of deaths, confirmed death, with the numbers of funerals with COVID-19 protocols keeps decreasing, indicating that the numbers of probables and suspects that pass away decreasing, and also indicating of the better testing capacity. And here is some reasons why we pull the emergency brakes in September. You can see in these two graphs our projections on the daily cases and also daily deaths. It was projected to be increased significantly. We have a G curve. So it's quite worrying at times, and it wasn't by the fact that the bore also increased significantly. The bore for the isolation rooms was about 80%, and the ICU about 83%, while actually we should maintain to be below 80. And if we didn't do anything, we projected that by end of September, the bore, both the isolation rooms and also ICUs, will be full. So emergency brake need to be pulled, and at that times the governors coordinated with the Pak Erlangga and also Pak Doni, the head of BNPB, that finally agreed to for Jakarta to go back to our initial PSBB. And I would like to share with you some response that have been done by Jakarta on the COVID. The first one, we anticipating the COVID and preparing the pandemic from the beginnings. We can see here some milestones from January to May. We start everything in early January. So 2 months prior to the announcement by the presidents of the 2 cases in Indonesia. So we that time socialized the Wuhan pneumonia. It's not yet called COVID-19, and we prepare the health centers, puskesmas, and also hospitals to be ready for the pandemic. And also the response team task force we established in early March. Also the website, as probably some of you remember, when people complaining to Jakarta, they say making the people panic on the COVID, because we share the data on the COVID on our website. And the second one, our effort is to increase the testing and the health care capacities. Now we have 61 laboratories, PCR laboratories around the Jakarta, and 98 referral hospitals. Initially, we have only one lab tester who did the PCR. That was already in end of April, when we finally was allowed to operate. And prior to April, only one lab, lead bankers, belongs to the Ministry of Health that serve the whole country. So now we have a very good capacity, even though probably still not enough, because some of the labs, they don't operate during the weekend. And here, the situations of the beds and ICUs in Jakarta, the bed occupancy ratio for the isolation rooms only 56% on the November 8th, and yesterday it was 57, increased 1%. And the ICUs is now about 60%, and yesterday about 59%. So the numbers of patients are decreasing while the numbers of bed capacity increasing. So the board we can maintain it better. Yes, this one was requested to be presented, the large-scale social restrictions in Jakarta. We did it informally in March when we closed school and also worships, and continued by the formal PSBB when finally agreed by the Ministry of Health in 10th of April. And to decide whether we need to continue or we need to relaxing the PSBB, we do it very carefully. We collaborate with the public health faculty of University of Indonesia to provide the indicators, whether we should open it, more or we need to close more. They provide us with this index comprised of epidemiology, public health indicator, and also health facilities indicators. Other than that, we also collaborate thoroughly with the BNPB. So they also provide the indicators. Those two institutions using these indicators, there's not fixed indicators, it continue to develop in line with the new findings, new knowledge on COVID-19. And nowadays in Jakarta is in the medium risk, no more in the high risk as in September. And the limitations on the social restrictions, you know that the essential sectors allowed to operate, but still need to use the COVID protocols. And here, I think I could share with you on the two sectors that been discussed thoroughly in the social media. The first one is the odd even policy, the ganjil genap policy, and also the restaurant. The ganjil genap, people, I think so many people suggested to end the ganjil genap that was reimposed in about June, only on a few weeks. But actually the data is in bahasa Indonesia, but I can explain it to you in English. Actually, the number of passengers using the public transportation should not increase significantly. Before GAGE, till the implementations of GAGE. And for your information also that before the GAGE was imposed, Jakarta increased the bus capacity by 25%. And probably some of you also remember that in February, the number of passengers of Transjakarta reached 1 million. So during the GAGE, the capacity, the rates that is used by the patients only about 35%. It was not included the additional capacity, the 25%. So we end the policy of GAGE not because of the increase of the passengers that risking the spread of COVID, but because not many people move from the private transportations to public transportations. And we could share also with you about the restaurants. This used to be open and then close, and then open again, and then close again, and open again. Now it's allowed to have dine-in, but with strict protocols. What happened when Jakarta closed? didn't allow restaurant to have dine-in, Jakartans go to other area. Jakarta go to Bogor, to Depok, to Serpong, to have lunch, dinner. But the risk of COVID still affect Jakarta because they live in Jakarta. And after discussions with also with the central governments, we decide that okay, restaurants can have a dine-in, but with stricter protocols. So if we find out that they did not comply to the protocols, they could be closed, temporarily closed for 3 days right away on the very day. So that's what happened. And the other reason is that without dine-in, malls are empty. People don't go to the mall for only shopping, but they go to the mall mostly for going to the restaurant. So the business, mall business, people also ask to be relaxed, but with the stricter protocols. So that's what happened in Jakarta. And you know about the safeguarding for the vulnerable group. We also got support from the central governments to provide staple foods packets. 2.4 million households obtain the bansos. So about 2/3 of the total household in Jakarta. So it's very big number. And another effort that I would like to share with you is on the developing digital system in Jakarta. We have Jaki. I hope that you have installed Jaki, especially you who live in Jakarta. And it has so many features right now, including the CLM. We call it CLM, the Corona Life meters. It developed together with the some expert from Harvard. It helps us to do self-screening to see if we are prone to COVID or not. And the features on the contact tracing, the checkpoint monitoring, this one to help offices, restaurants, and venues to check if the capacity already fulfilled or not. If the protocols only allowed to operate 50%, that when it's reached 50%, they have to close to the new customers. And we also enhance our citizen relations management, CRM, to allow people to be able to report if they see some protocol violations. And here, another effort that we have done, we call it large-scale social collaborations. It is done by Jakarta Development Collaborations Network, in which I am the head of the ad hoc unit that was established in early of this year. Initially, we work for urban regeneration to think about problems in Jakarta like flooding, banjir, macet, and waste management, etc. But since COVID, we changed our work to be COVID. The first initiatives we did is doing this one, preparing platforms for people to help others. So we provide information in every neighborhood how many poor people in the area, so that others can help. It is also available in Bahasa and also in English, so everyone could see also from in our website. This is in the same website of corona.jakarta.go.id. So by having this, individuals or organizations could select by themselves which area that they would like to help. And this also avoid duplications in the provisions of support for the poor. And by today, we already launched 3 collaborations. The first one is for the staple food. Even during the Ramadan, we could distribute more than 600,000 packages from the community to the needy in Jakarta. And we also already implement the collaborations for the SMEs. You know that the SMEs suffer so much from the COVID pandemic. So we help them through provisions of infrastructures, also trainings, and also the capitals. We got the capitals, not many, not much yet. It's from the I forgot the names. But the trainings we have done a lot to train the SMEs for the production, for the marketing, etc. And another one is not yet even formally launched. It's for education. So we invite people to help students who don't have a gadget, who don't have smartphone for their study from home, and also for teachers who don't have a computer. Only in a few weeks, we already got a support 10,000 SIM card, Kartu Pradana, and also more than 1,200 of gadget, smartphones and tablets, and also laptops. You don't have to give us the new gadget. It can be second hand, but until now all are new. This one exclude the donations that we collect during the system was established. I think it was almost 1,500 gadget we collected, and many also from the alumni groups. So you could help the students, the poor students in the schools that you were studied. And here are some collaborations that we have done so far, not only on the social economy, but also in culture, etc. We do everything for the people so that they still can operate better. And this is the lesson learned we got from what have done in Jakarta since March, since January actually. The transparency matters. We really try our best to provide information for the for Jakartans. And data are useful, also science. It guides us in decision making. IT, you can see it helped us a lot to do all what we have done so far. And collaborations work. And during the pandemic, social solidarity increased. Even though the number, the amount of support that given become smaller from the data, but the number of people who are willing to help increase significantly. And communications also work. I would like to share here because since the communications of between central government and local government have been done regularly, led by Pak Luhut, the communications becomes the management of COVID becomes much more efficient and effective. And we have meetings almost every week, and the teams, the technical teams, have regular meetings more than once a week to discuss about tracing, to discuss about testing, and now to discuss about vaccinations. And before I end my presentation, I would like to invite you all to come to our GDCN forums on the 17th to 18th of December. It's all virtual. So we would like to showcase our collaborations, not only during the pandemic, but the previous ones, and also to provide rooms for the discussions, to share ideas for the future collaborations. And on behalf of the government of Jakarta, I would like to invite you, if you would like to have a study, to do research surveys in Jakarta, you are very welcome, and we are willing to share our data and to help you if you need samples from Jakarta. We have a link from Balai Kota, the City Hall, to the Kelurahan, even to RT, because now, because of the COVID, uh, almost every neighborhoods have WhatsApp groups. So once we have important information that need to be shared with the people, they can get it right away in a day. So that's my presentations. Any comments, any questions, advice for Jakarta to manage better this pandemic? Very welcome. Thank you.
Thank you, Bunda Harti. Mbak Harti, silakan Mas Budi.
Thank you, Nuke, and special thanks to Bu Suharti for her willingness to participate in our activities, and also presenting a very comprehensive presentation on the effort of Jakarta City. I personally amazed on so many activities and creativities that has been developed in Jakarta. So this presentation that I'm going to do is in collaboration with Rusan and Tian from University of Indonesia and Anna at the Bureau Statistics. So our interest is looking at what happened in urban area. And so that is probably differentiate our work with some other big groups that conducted similar activities throughout the countries, but our interest is limited to see what happened in what happened with livelihood in urban areas of Indonesia, and we choose at the moment two cities, Jakarta and Yogyakarta. So these are some initial observations. We're still working on it. So let me remind everyone the situation in Indonesia when this pandemic hit the country. In general, I would like to argue that the Indonesian economy actually have been performed better compared to many other countries. However, there are some tendency that the growth to decline. And so far, I haven't seen there is a clear indication how to boost the growth. So the economy is growing rather well, but it is not in an upward growth trend. Indonesia also just recently got a new cabinet. The cabinet was formed last year. Many of the ministers are new ministers, including the coordinator minister of economy, minister of health. So teamwork and adjustment are actually happening when the pandemic hit the country. So that needs something that need to be taking account in seeing government respond as well as the successful of some policies. And the other aspect is that Indonesian health sector is not very big, but remain weak. It can be seen by the fact that Indonesia has been or still struggling in managing several communicable diseases such as TB, dengue, and malaria. So while there is an increasing trend on non-communicable disease such as stroke, heart disease, and diabetes. So the health sector is in a way moving, but not in the best performer. So the general situation when this pandemic came is in a way a bit unlucky for Indonesia. Now, meanwhile, since our interest in urban area, what have been happening in urban area, urbanization has been ongoing. Number of people in urban area keep increasing, and by 2018 2019, it is predicted that almost 60% of Indonesian population are in urban areas. So more and more people in urban area of Indonesia. In urban Indonesia, typically overcrowded houses, overcrowded transportation, and in general, to do any limited space to do any activities. Labor absorption in urban area seem to be rely on informal sector or activities where working benefit are not provided. So those dynamic is happening in urban area, and I will show you how important the informal sector in Indonesia. This is the data that produced in 2018. It can be seen that although this is covering both rural and urban area, but micro enterprises in Indonesia, and I believe in urban area is significant for labor absorption. And we can see that number of entities there are so big. So people do rely on this sector. And so this sector is important in terms of seeing the dynamic happening in urban area when this pandemic hit urban area. And but as mentioned by Bu Suharti, there are a lot of creativities coming up because of the technology, and this is concentrated in urban area as well. And Indonesia is not an exception. Internet connection growing very fast, particularly in urban area. The use of smartphone has been presented, that a lot of smartphone has been used for a lot of other stuff. Although challenges remain, access is not equally distributed, even in urban area. Still considered expensive, and quality in general low, and human capital abilities in optimizing the use of internet is also something to be discussed. Now, why we would like to focus in urban area? Well, globally, the reports show that pandemic has been concentrated in urban area. UN said that approximately 90% of reported cases are in urban area. And the issue of pandemic in urban area deeply rooted on inequality of access, facility, welfare, sanitation, and public facilities in urban area. And also in urban area, COVID measure are typically difficult to implement because overcrowded houses, space are in general are limited. And so the impact of this pandemic in urban area most likely will be more significant than in rural area. However, data around the world also show that not all urban area got a problem. Some urban area have strong urban community solidarities and resilience, so they're having strong social capital. So that's one factor that's important. Well-organized housing, so that's also another factor that's important. And also quality of government. Some cities have a good quality of government, and also backed up by strong financial support. So at least there are four things that could make urban area different. One is the social capital of the people. Second is the planning. Third is strong local government. And the other one are backed up by strong financial support. Some example could be seen, such as what happened in Hong Kong, Seoul, and Taipei. So in Indonesia, if you look at the distribution of COVID, you can see that many high density of COVID are in urban area, particularly in Jakarta, a little bit in Yogyakarta, and over here in Jember and so on, but Surabaya is also high. So urban concentration of COVID cases in urban area is also happening. And so our interest is looking deeper on cities in Indonesia, what is happening, and we choose Jakarta and Yogyakarta for the following reason. So we look at Jakarta as a province. So in Yogyakarta, we also pick a province, not a city of Yogyakarta, because the city of Yogyakarta is too small. And you can see the contrast of Yogyakarta and Jakarta in terms of population density. Jakarta is much dense comparing to this province of Jogja. And the other thing, choosing Jogja, is the role of the governor of Jogja is very strong. So it is equivalent system of government between Jakarta and Yogyakarta, although the structure could be different. So we picked these two areas for comparison. And if you look what happened in Yogyakarta, as Bu Suharti said, that by 9 November, about 130,000 cases in Jakarta, and causality reached 2.4 thousand. But the death rate in Jakarta has been lower than Indonesia in general. In Yogyakarta, the number of cases has been much lower, only about 4.3 thousand cases. And causality is also has been lower. Although the death rate has been a little bit higher than Jakarta, but it is lower than the rest of Indonesia. However, there's if we look in different way, so please remember that PCR test in Jakarta has been much higher than in other places. So this comparison is not 100% true, but you can have a feeling how tense actually the situation in Jakarta comparing to the rest of Indonesia. So for example, if we look at the probability of people being detected having COVID in Jakarta, this dash line is showing the probability of people in Jakarta actually detected having a COVID case. This rate is much higher if you just stay in some other places. So this could be driven by two things, the test rate, but also the spread of the pandemic. But if you were in Yogyakarta, the situation is much calmer, even comparing to the rest of Indonesia. So that is a contrast of what happened in Yogyakarta. Of course, again, I keep saying that this could be driven by differences in number of testing. And if we look the probability of identified deaths due to COVID, you can see that this dashed line are the Jakarta case, the probability that somebody is identified that because of the COVID has been much higher, and the trend is actually upward, and this distance between Jakarta and national spreading out till October, end of October, while that is not happening in Yogyakarta. So hopefully I can give a feeling that the situation in Jakarta has been much, the tension of this COVID has been much higher in Jakarta than in other places, particularly compared to Jogja. So what we did is we conduct, together with Rus and Pian and Anna, we conduct a survey in phone survey in Jakarta as well, and in Yogyakarta. Our team is very small, so we cannot do simultaneously. We do in Jakarta for about almost 2 months survey. Our sample come from our previous flood survey. We got 600 households, but that is not enough. So luckily we got this phone number from micro and small enterprise responding during the 2016 DPS. So we choose randomly 4,000 more sample to approach. So in Yogyakarta, we do it after Jakarta. So once we do Jakarta issue settle, we do Yogyakarta between 14 June to 17 August. Of course, things has been changed a lot between then and right now. So a numerator was a local student. The question that we ask have several components. One is respondent characteristic. We asked about health issue. We had about mental health, social distancing, expenditure, food insecurity, social assistance, death, and working status. So the total question is 40 questions, and the length of the interview typically only 15 minutes. So we have very limited time to be able to interview people, and I will show some results, but not all. So what we get, so from the list that we get from Yogyakarta and Jakarta, lot of this number we cannot actually connect it. So people in Indonesia change their mobile number rather often, and this most of this data are 2016. So 4 years after 2016, everybody seemed to change their phone number. And among those that we get, this about 67% in Jakarta say they don't want to be interviewed, and about 51% in Yogyakarta say they don't want to be interviewed. So this is the rest that we have. So one of the things that we work so far is actually finding the proper way to provide weight, so then our interpretation could be relatively correct. So who are those who we can interview? Well, almost half are female. They are around 45. So this Jakarta and Jogja, in terms of this characteristic, relatively the same, and household size is also the same. So these household characteristics are relatively the same, except most people in Jakarta are migrants, about 56% comparing to 30% of people that we are able to interview are migrant. And if you look at the expenditure last year, the last year monthly expenditure, our sample seemed to be relatively equivalent. So the middle mostly are in this size of expenditure, although Jogja get more poorer people comparing to Jakarta. But if you look at the mean, they are relatively comparable groups. And if you look at their occupation, which sector they work, you can also see that this graph is almost similar, except there is a mining in Jakarta. Manufacturing is more of manufacturing fuel that we get, but not over here. But mostly in services and trades are those in our sample. So comparing this data seem to be relatively okay for us. And first, to see whether there has been a lifestyle change due to social distancing. So over here we ask basically whether they know about social distancing and whether they comply. So over here, do my best is the saying that they are doing their best to comply, and do not try is basically they don't even bother to do that. And you can see that in general, Jakarta people are more compliant than Yogyakarta people. However, as been discussed in several papers, that to be able to success in controlling the pandemic, you need more than this percentage to comply, so that the spread of the pandemic can be controlled. The next slide is looking at the change of number of weekly working. These are in hours, but let's just look in percentage. In general, Jakarta people lose or have to reduce their percentage almost 50%, while Yogyakarta is about 30%. And each sector differently affected. So hotel and restaurant in Yogyakarta was hit a lot, while in Jakarta is construction that one that hit that high. So how this pandemic affect each sector has been different. And if we look at reduction of income in general, everybody has been reduced their income by about 500,000 to 2 million. However, more being actually are in the high, more reduction in Jakarta comparing to Yogyakarta. So in a way, Jakarta a bit skewed to more affected than Yogyakarta. This is consistent with the percentage number of working hours that have been affected in Yogyakarta and Jakarta. Remember that many of them are micro and small enterprise. However, when we look at monthly consumption relatively, many of them are basically saying they still being able to maintain their level of consumption comparing to the situation pre-crisis. So a lot of them must be using their saving or some other way. But the effect is affecting highly through job and income, but not so much on expenditure. And if we look at feeling food insecurity, everybody basically say that not at all, although there are indication of people have to reduce their usual pattern of eating. In terms of receiving social assistance, you can see that governor of Jakarta worked better because a lot of people, almost 60% of people in Jakarta receive some social assistance, at least one social assistant from the government, while in Yogyakarta has been relatively limited. So a lot of people in Yogyakarta have not getting anything. Although their income is affected as well. So then we start asking whether they are physically being disturbed in terms of going to work, communicating with their friends and so on due to COVID. And many actually saying very affected. The pattern from Jakarta and Yogyakarta is almost the same. So in terms of actually being disturbed by the pandemic, both are relatively the same. But when we come whether they are feeling disturbed, whether they anxiety, the Jakarta people express it that a lot of them are very disturbed, so they feel a bit they feel unhappy. And in Yogyakarta, yes, they are in this side, but it's not the same as Jakarta. So in terms of unhappiness, Jakarta people probably feel more unhappy than Yogyakarta people. And when we ask how many of them are feel need to consult with a counselor, only very few actually saying yes. So even that the one that feel very disturbed by this pandemic say no. So this is consistent in Yogyakarta. So that is really a question why this is the case. Is this because people do not know that they actually can have a counseling support, or counseling support are not provided both in Jakarta and in Yogyakarta? And this fact is actually important. If you see the majority of people are in a way feel unhappy, and so it could actually lead to a mental issue. While over here, you can see that they are not channeling those unhappiness to probably an appropriate venues. So that is the observation at the moment. This observation argue that the impact on the pandemic on livelihood in Jakarta is significant. approximately 55 to 42 people do their best not to be away from home in Jakarta and Jogja respectively. However, higher number might be needed to be able to control the pandemic. Reduction in number of weekly working hour translated to reduction in individual monthly income. However, majority of households in both cities were able to still maintain their monthly expenditure. It could be through they have saving, it could be through social assistance. Government social assistance dominate the support for both cities. However, the programs seem to work better in Jakarta. Cases of feeling anxiety due to the pandemic does occur in both cities, and this feeling occur more in Jakarta. Nevertheless, few of these people think they need to contact a counselor. Understanding why it is so is more likely important for the people in Jakarta and Yogyakarta in terms of being resilient toward this pandemic period. That's my presentation. Thank you.
Thank you so much, Mas Budy. That was really, really interesting results. I would like to invite questions from participants. And I think I'll take a question from Ibu Roxana Khan from Prospera, and also from Pak Terry Hal, and from Nomura Rangga for the first round. Thank you. Silakan Ibu Roxana.
Can you hear me?
Yes, thanks.
Oh, sorry. No, I was just interested to also understand that in terms of the numbers, we've had different reports.
Hello, Fris.
How trustworthy the numbers are, and also, you know, there was another group that was counting. Can you hear me?
Yes.
Sorry. So yeah, that's my.
Yes, keep going. Is that all? Have you asked the question? Sorry.
Yeah, yes.
Yeah, okay. Yeah. All right. Okay. Pak Terry, silakan Pak.
Thank you very much. I'm stunned by both presentations. The amount of data is much greater than I ever imagined would be available by this stage. I was particularly taken by Pak Budy's comment about anxiety and the need for a counselor. Of course, I'm feeling a great deal of anxiety, but it's not about COVID, it's the US election. And I think that there's lots of reasons why people can feel anxiety, and how it fits with COVID, I think, needs some deep investigation. Ibu Suharti's graphs are extraordinarily detailed. The one or two things that I'd like to ask there are, one about what has happened in terms of the data collections in Jakarta on the population census. We could have been seeing data results by December if the census was not upset by COVID. Is the Jakarta government expecting to get data before the end of the year, which would help in framing more about the denominators, the base numbers for many of these things? And the second thing was, I see in some of the tables that you've attempted to estimate the number of people who may have died of COVID, but were not officially said to have died of COVID. And we've heard of many cases like that, but do you have some sense of how those numbers have changed in the percentage terms over the year? Thanks very much.
Thank you, Pak Terry. Nomura Rangga. Are you there? Okay, I will read Rangga's question. He has two questions. I think this is for Bunda Harti. Why are the daily tests in Jakarta trending down since mid-October? And then the other question is, does Jakarta government expect daily cases resurgence following long holiday in the end of October? Okay, I think I will ask Bunda Harti to, Ibu Harti to respond first. Thanks.
Yeah, for the information from for others that Nuka call me Bunda since the beginnings of the 2009. So I'd like to respond to the first questions from Roxana Khan about the difference report. Is the data trustworthy? Actually, the data is the same. What's the difference? So we use the same systems. We call it NAR, provided by this Ministry of Health, the new all record. So all the labs fill the data on the system. Why make it different? Because some of the labs reported lately. So, for example, a few days ago, when the report from the labs on that very day was about 700, but the nationals reported to 1,000, more than 1,000. What happened? Because 300 among the thousands actually should have been reported in the weeks, in the last 1 week. So in Jakarta, those 300 data is distributed in the according to the date when the test finished. So not the when the data were reported. So that makes the two data between the Jakarta data and the central government data different. Probably it could answer your questions. The second question, the last question first before Pak Terry. Yes, there's some decrease in the number of tests because of probably one very issue, the price of tests. In terms of the program tests that done by the governments through the tracings doesn't change, but the non-programs tests decreasing. Those for the independence test, like for example, you could go to the lab by yourself and to check if you are infected or not, or the ministries also. Because the BPKP, apa bahasa Inggrisnya BPKP itu? End of September, they set the new price, standard price. So for the PCR, for the non-programs, it was set about 900,000 for maximum price. While before September 13th, it's allowed to be even more than 2 billions, depending how long you are willing to wait. Some even 2 millions and 500, and some, but mostly more than 1 million. So probably that also affects the willingness of laboratoriums to do testing. And the decrease is actually not a lot for the wait. I have Dr. Ngabila here that have all the data. So yes, in the November, only about 76,000 per week, while mid of October, it was almost 90,000. So that's one very important reasons why the number of tests decreased. Pak Terry, I think so. We couldn't get the data of census by end of this year. Pak Buyung met me a few months ago, and the in-person census was delayed that time because of the risk of COVID, and some of the staff member in the field infected by COVID. So that's what happened in Jakarta. And questions about whether we prepare anticipating the effect of the long holidays. Yes, a couple of actions we have done. First, we work with the Dasa Wisma cadres. They are instructed to monitor the neighbors who went away during the holidays and inform them to not postpone to go to the hospitals or the health center if they have a symptom, any symptom. So that could save lives. And we also prepare more rooms, more isolation rooms and ICUs. And a good thing is that the bed occupancy ratio is less than 60. So we are in a good shape. The board is not included the Wisma Athlete hospitals and isolation room. So I heard that I think last week the board in the Wisma Athlete is less than 30%. So in terms of capacities, health capacity is we are in a good position. I think one more from Pak Terry. The difference of the data on the deaths from COVID and the deaths from the funerals, the data on funerals with COVID protocols. Pak Terry, it is also due to the length of wait for the test to finish. So in September, it increased to be even more than 5 days on average, some more than 10 days. So the more the patients, the more the longer we need to wait for the test to finish. And but nowadays, as I presented earlier, there's the gaps decreasing. Now it's only I think twice, and mostly due to the results of the labs is not there yet when they pass away. So that's that I could answer for the questions from the three participants. Bu Nuke, thank you.
Terima kasih. Thank you. Maybe Ibu Dr. Ngabila Salama have something to add?
Yeah. Can you explain about the testing and tracing, Dr. Ngabila? She is the head of the unit for the surveillance in Jakarta.
Okay, thank you. But I think that's enough. Very clear the explanation from Bu Deputy. Thank you.
Okay, thank you. Mas Budy, then please, thanks.
Yes, thank you. No, so there's one question from Terry related to anxiety. So really, Terry basically argue on the reliability of the question. So yeah, it is. So when we develop this question, we consult with a friend from the psychology department at the University of Indonesia. She is Rus'an's friend. So we basically asked her to give a set of questions on feeling stress. We could not put standard PTSD like 13 questions because this phone survey limit us in terms of number of questions. So she come up with this 3 questions, and we tested before, and so then we apply to the survey. So the question is particularly reference to due to COVID. So the sentence is exactly asks whether you feel anxiety due to COVID, the ongoing cases of COVID pandemic. How actually valid those question certainly open for discussion. Thank you.
Okay, thank you. In the second round, I will take question from Pak Chris Manning, Aliza Hunt, and Prabowo. So please, Pak Chris, silakan.
Thanks very much, Paul. Can you hear me? Yes,
thank you, Pak.
Yeah, great. Terrific presentations from both speakers, very informative, and particularly Suharti, in that I didn't know much about the details of Jakarta, and that was really very informative. And of course, Dr. Pak Budy, even though I live here, I don't know what's going on. I had a question for Suharti. You didn't say much about collaboration between the provincial government and the central government, both in the provision of overall policies and in support programs. I wonder if you could say a little bit about that. I know there's been a lot of discussion of those sorts of issues in the media. And one question for Pak Budy, although it wasn't covered by your survey, in Jogja there's a general sense that the public holiday periods have made a significant contribution to the spread of the virus here. And more generally, that seems to be a view more widely. Do you have any information about that? I know it's not in your questionnaire, but maybe some of those issues were discussed. Thanks very much. Terima kasih.
Thank you, Pak Chris. Aliza?
Hi. Thank you so much, Bunda Hati and Pak Budy for the presentation. Bunda Hati, I won't labor you with any additional responses. It's been incredibly comprehensive. It's amazing programs that are going on in Jakarta, and of course we would expect nothing less from yourself. But my question is actually for Pak Budy, in a bit of a follow-up, I suppose, in terms of Pak Terry's question around the anxiety measures, which you can always debate the validity of the anxiety measures till the cows come home, because I mean it's the main topic of my thesis at the moment, so it is a highly contentious issue in terms of assessing mental health issues in Indonesia. I'm really interested to learn a little bit more about how you define counsellors, because of course accredited counsellors using Western psychiatric type of methodologies are a particular type of counsellor, psychologists, psychiatrists, informal counsellors, etc. But those that might be using different types of counselling methodologies, coming from religion, coming from community, wondering if those sorts of individuals might have been considered in your survey, because we know there's a high level of stigma that's associated with people seeking mental health support in a lot of places, including Indonesia. And I'd be interested to learn a little bit more about how that might factor into your results.
Yeah. Okay. Thank you, Aliza. Pak Prabowo, silakan.
Thank you for your presentation. I have a question regarding the case study of Yogyakarta. If you compare the city of the capital city of Jakarta and Jogja is very much different. So basically, I'm interested in if the Professor Budy has some findings on how the people in Jogja cope with the crisis, because Yogyakarta has been suffering from the COVID, especially the tourism industry. Thank you very much.
Okay, thank you. I think I will allow Mas Budy or Bunda Hati to speak first.
Silakan Pak Budy.
Silakan Pak Budy.
Okay. Thank you very much. So regarding Pak Chris' question, the holidays tend to kick the number of COVID cases higher in Yogyakarta. We can actually see in this slide when we were asked whether they are actually complied to whether they're trying to comply to PSBB, and Yogyakarta people in a way is much more relaxed compared to Yogyakarta in terms of trying to basically not going away from home. So So that part is could be happening. Although there is one part that why this research is ongoing is that the social capital in Yogyakarta, our argument will be like much stronger than what is it in Jakarta. So at the moment, we are actually collecting data to measure social capital to accompany this observation. And as you probably know, many of our friends in UGM participate in sojo activities, which is basically encouraging community to defend their livelihood through informal activities, informal group of activities. So that part is what we know of Jogja. So in terms of compliance, Jakarta people a bit more compliant. Second question related to what kind of counselor. So that is the thing that I forget to mention, is that so we are actually required by any ethics committee to have to provide a page basically listing all the formal counseling or counselor that are available through phone in both cities. So that is the standard. And so when we mention counseling, we actually have to explain that there are counseling activities that are conducted by professional psychology, and they are free, and this number. So before we are allowed to conduct a survey, we actually has to contact the Psychologists Association in both Yogyakarta and in Jakarta. And luckily, actually, those association has been established this phone service association, and expecting that there could be a massive mental health issue due to this pandemic. However, the outreach of this activity, it seemed to me, has not been that great. So in terms of having this list, we are actually being able to get the list. And surprisingly, about 20, at least 20 numbers that are actually available for people in Jakarta and in Yogyakarta in terms if they have mental health issues. So before we ask a mental health issue, we actually explain that, well, this we are going to ask a sensitive question. This is about your feeling, and if you do not comfortable, one, you could stop, and second is that if you feel needed, there are numbers that you could contact related to or that could helping you easing up your feeling if you have one. So the type of counseling that we mentioned, we have to mention in before the question, and that is the standard that was pushed by ethics committee in ANU. So they know exactly what kind of counseling that we're talking about. Thank you. Oh, there's another question. Oh yeah, okay. Maybe next time. Bu Suharti.
Thank you, Pak Chris. Chris Manning for the questions. Yes, Pak, we do collaborate with central governments and also with the other local governments and also with the international agencies. With the central government, we divided into two issues: the social support that we collaborate with the Ministry of Social Affairs in the provisions of food subsidy. Till now, but from the 2.4 households that got the subsidy, 1.3 million households received it from the central government. But we do collaborate in the data management to make sure that there is no double data, and also collaborate with the others ministry like Ministry of Home Affairs for the Dukcapil data, apa Mas Firman, Dukcapil data, lupa saya. Yeah, so we need to make sure that the data, the people are there, because during the COVID, not only the Jakarta IDs holders that can be given the support, also people who have the IDs from other provinces, so that for the verifications of the data, we got support from the central government. And for the COVID management, the cooperation even better after Pak Luhut was assigned by the president to handle the COVID in 8 provinces. So meetings to get solutions, particularly for the testing, increasing the testing capacity, increasing the tracings. Now we are preparing for the new strategy for the tracings. It is helped by the teams from Pak Luhut office, and also the treatment, to make sure that the hospitals capacity in a good situations. And with the international cooperation, but we have sister cities. So because of the testing, the PCR machines cannot be bought easily. We do have money, but the machines are not there in the market. So, for example, we order a machine from Swiss about 2 months ago. It said that they could only deliver it next year. So we, the governor, write letters to the sister city, big cities, surely, to not to ask for a new machines, but to borrow. And you know, even they cannot do it because it's cities also need the equipment by themselves. But we got help support, one machine, speed machine from Korea. We got also one from Singapore, and we got lots of support from other cities, like from a couple of cities in China for the CTM, for the protective equipments. So we do lots of things with the cooperations. And I think that's the question for me from Pak Chris Mannings.
All right, thank you, Bunda. I'm going to take another round of questions, and this time from Pak Hal Hill. Ibu Mailing, I think Ibu Mailing has dropped, and I will read the question from Clara Siagian. Silakan Pak Hal.
Yeah, thanks Nuk, and banyak terima kasih to both speakers, Bu Suharti, hello, and to Bud. Hi, I really enjoyed them, very insightful. Can I just ask a brief question to each speaker, please? I'll keep it brief. First one to you, Bu Suharti, if I may. It's a little bit related to Chris Manning's question. So, in all countries during the pandemic, it's been difficult to maintain sort of nationally consistent policies, especially in spatially very large countries like Indonesia and Australia, US and all that. I'm just wondering if you could tell us a little bit more about that, since your focus is Jakarta, but presumably Jakarta has moved more quickly than most of the other provinces. But then I guess you can't really completely seal off your border from West Java and Banten and elsewhere. So I'm just wondering how you manage that sort of local policy in a national context. And Bud, could I ask, one interesting finding from your survey is that the social assistance from governments was fairly different between Jakarta and Jogja. The question I had is, I mean, aren't the key social assistance policies really national? That is, things like PKH, Kartu Sembako and all that. So does that mean that, in a way, they were not going out consistently across all regions, or was it just that the interpretation is the Jakarta government actually had quite a lot of additional social assistance programs, more than the Jogja government. So thanks again. I really enjoyed both presentations.
Thank you, Pak Hal. And I'm going to read the question from Clara Siagian. This is for Ibu Harti. I wonder if Ibu Harti could elaborate a bit on Jakarta's plan and strategy to distribute and administer vaccines, especially who the prioritized groups will be once a vaccine is deemed safe and effective. Thank you. And I will ask Firman Witular, who has a question, I think.
Thank you. This is actually for Bu Harti. Thank you so much for the presentation and the amazing data. My question is about PSBB and in particular the enforcement of it. As much as you want to impose restrictions, enforcing them seems to be impossible sometimes. So how do you deal with extraordinary events like the omnibus law demonstration a few weeks ago and yesterday's executive arrival, for example? You may not be able to do anything during the events, but is there anything you can do afterwards? Is there something under your DKI jurisdiction, or this is something that the central government needs to do more about? That's it.
Thank you, Firman. Ibu Harti, silakan.
Thank you, Bu. From Harhil, hi Pak. Long time no see, Pak. Jabodetabek is already one big cluster. We cannot be separated from one to the other, so that all the PSBB's policy we set together. So they say that please Jakarta set the protocols and we will follow. They always say that. But since it is coordinated by the Ministry of Maritime and Investment, the coordination is better, because if Jakarta imposed in a certain protocols and Jabodetabek didn't do it, then Pak Luhut could ask them to follow what Jakarta is done. So that's what we do with Jakarta with Jabodetabek, and not only in terms of the restrictions, but also in terms of the social support. We have to do it together, because I think many of the Jabodetabek's populations, they work in Jakarta. So that Jakarta, even though we have only 10.5 million populations, during the night, on the daytime, it can reach to 13 to 14 million. So actually, they are part of our populations. And we also provide support for the health facilities. In Jakarta, about 30% of the patients in the hospitals are from Jabodetabek, from surroundings areas. So it is also one part of the cooperations among the Jabodetabek's governments. And for Clara, about the vaccines, it's already set by the central governments who need to be given first. So what we have been doing is to identify individuals by name, by address, who are in the frontliners of COVID handling, like the health workers, the Satpol PP, the people in the markets, those kind of target groups that we have already got the data by name, by address. So regardless when the vaccine will be executed, we already have the information, so that we hope that the vaccine is ready not very long from now. But we will only do the vaccinations if the vaccine is already set, safe. We don't want to put our people in danger for sure. That's the answer, Mbak Nuke. Thank you.
Thank you. That's very
omnibus law demos. We cannot do anything on that because the permit is not from us. what we do is just to be prepared if there are people got infected, so that they have to be isolated in our places or in hotels, or to the hospital if the symptoms is mediums or heavy symptoms. That's Mas Firman. We do hope that no more demo. Because like the last demo, it's not only the COVID, Mas, but also the victims of those who got during the demos, and also all the dilapidated facilities. We have to fix everything in a day or so. Like for example, the halte, it finished only in 2 days. All the cleanings, the orange, the blue, the green, the what else? Teams, we ask them all to do the cleanings after the demos. So we hope that the all facilities can be used right away in a day. Thank you, Mbak.
Thank you. Mas Budy, you would like to add?
Yeah, thank you, Hal, for the question. You always able to ask the right question. So it is actually the one of the questions that I do have. You know, given that their income reduced by about 30%, how come they actually could spend the same amount of money for expenditure? And then so we look at the social assistant, and social assistant actually one is actually relatively small comparing to the 30% reduction of income. So the sustainability of this is actually an issue. And second is, you're right, how come this difference? So the main, the two main social assistant are the one that's really big is the Kartu Sembako, the staple food card. This is the everybody that in data terpadu got this support. PKH is actually on top of those. So among those 20 million people receiving Kartu Sembako, if they got a pregnant woman or children, they got another additional, which is the PKH. So the main basic one is the Kartu Sembako that's supposed to cover 20 million people. Now, this is central government program, and how could be that different between region? Well, there's two. Two issues. One is the exclusion error. So it's very. So it could be possible that the size of exclusion error in Jakarta and in Yogyakarta are different. So that is, and also remember that the list was 2015 list. That is also another issue. So it's not covering the dynamic between 2015 to 2020. Now the second source of differences. So beside those, I mentioned the Kartu Sembako, which is the main one, and PKH on top of that, there is another package that try to cover those who not receive Kartu Sembako, and it called BLT or Bansos in Jakarta called Bansos Sembako. They're organized by the Bu Suharti, please correct me, that organized by the local government, and that is for Jakarta, but for outside Jakarta it called Bansos Tunai. And who organized that? That is the second biggest social assistance program in terms of the outreach. So for example, in Jakarta, is supposed to cover additional of the people that receiving kartu sembako. About 2 million people received this bansos sembako. So that kind another. And outside Jakarta, it is estimated about 9 million people will receive this bansos tunai. Now, the implementation of whether it is bansos sembako and bansos tunai could be different. And that is, they are required to, in a way, register to get this support. And the other support are relatively small, like kartu prakerja and so on. But that, I thought that the three main support and they could difference. But the main thing that I worry is that the size of reduction of income is not equivalent with the size of all this assistance per household. So whether they actually could stay keeping up their expenditure as pre-pandemic for a longer time have been actually an issue for me. Thank you.
Thank you. I'm just going to squeeze one final question from Katiman. This is for Bunda Harti. There is a tendency that people do not want to admit that they are having COVID-19 due to several reasons, such as having an aib, and if they admit that, they will be asked to go to the hospital, which they may face other problem. How does Pemda DKI respond to this issue? Please be brief, Bunda. Thank you.
Yes. It happens in here and there. They don't want to be put in the isolation ward if they are known as a confirmed COVID. What we do is work with the RT/RW and also the Dasawisma cadres to provide them with the information, the belief that it is okay to be isolated, and we take care of the families. If they do have the families that have to be home without any support, and then we will take care of them, including also for the children's. The neighbors will take care of them, all the families. But we do some things to make sure that they are safe and they are willing to be hospitalized. It happens also with a friend of mine, educated. He got symptoms. He didn't want to be swabbed, but then I said that you make other people's in danger. So he got swabbed and positive. And finally, he was hospitalized, and all the family members are positive. So the communications, our communications need to be improved better and better to make sure that people understand this, the risk of COVID, and also to increase the willingness of them to report if they are infected. Not only that, it also happens in the offices. After the imposition, we imposed the latest PSBB, because we say that we would like to close if they have confirmed cases, some of them, then no more report if they have confirmed cases. So now we would like to change the policy by giving a reward if they report the cases, but we close them if we finally find out that there are staff members who are positive but they don't report it. So it's a really an art in managing this COVID, and to still keep improving the knowledge and the awareness of people on this issue.
Okay.
That's Mas Katiman.
Yeah, thank you. Thank you so much, Bunda Harti. With that, we conclude today's seminar. Please join me in thanking our wonderful speakers. Thank you, Mas Budy. Thank you, Ibu Harti. It's been really good, very informative, and I'm handing this over to Acho now. Acho, would you like to close this? Thank you.
I will share the presentations to Nuke, and Nuke could share it with you all.
Thank you. We will put it up on our website. Thanks. Over to you, Acho. Thanks.
Okay, thank you so much, Nuke. And thank you, Bu Harti and Pak Budy. And we will have a special event. The ANU Indonesia project is going to have Sadli and Mubiarto lecture this coming Friday, the same time. So that's 13th of November, 9 to 11 a.m. in Jakarta time, 1 to 3 here in Canberra. The speakers, the topic will be industrial policy, and the speakers include Professor Justin Lin from Peking University, Edi Purnawan, Dr. Edi Purnawan from Gajah Mada, and Dr. Keki Feriko from UI. And for the global webinar on COVID-19, we will have another one next week from LPAM team, same time as today, about economic recovery after COVID in Indonesia. So with that, we can conclude today's event. Thank you, everyone, and see you,
Thank you.
Friday, hopefully.
Thank you.
Thank you.
Yeah, thanks very much to the speakers. Great
Ketemu
presentation.
semua kayak reuni.
Terima kasih banyak.
Just like a reunion, Pak.
Yeah.
Yeah.
Yeah, lovely to see you, Bu Harti. You're looking very well.
Very busy.
Ya, pasti sibuk sekali.
Stay safe, everyone.
Yeah.
Bye.
Yeah,
Yeah.
see you.